Hey doc, I hope you are doing great. Today we will be discussing about rubella, its causes, symptoms, complications and management. Rubella, also known as German measles or three-day measles. The rubella virus is a member of the togavirus family. It has an average incubation period of 12 to 23 days. Rubella spreads when an infected person coughs or sneezes. Also, if a woman is infected with rubella while she is pregnant, she can pass it to her developing baby. The symptoms mostly appear 2 to 3 weeks after the exposure to the virus, lasting about 1 to 5 days. The symptoms consist of mild fever of 102 Fahrenheit or lower, headache, that is usually accompanied by either stuffy or runny nose, as well as aching joints, especially seen more in young women as compared to men. The important thing to remember is the characteristic feature of the disease, which is post-auricular, occipital, and posterior cervical lymphadenopathy. Another feature is Forchheimer spots that are seen as small, red spots on the soft palate in 20% of patients with rubella. However, they are not a diagnostic feature. As I mentioned earlier, that rubella is also called three-day measles or German measles, a name given to it because the two illnesses share some symptoms, including the red rash. However, rubella is caused by a different virus. Rubella is a mild infection and complications don't usually occur. But some women who have had rubella experience arthritis, which generally lasts for about 1 month. In rare cases, rubella can also cause an ear infection of the inner ear, encephalitis, that is inflammation of brain, hepatitis, inflammation of liver, and thrombocytopenia, that is low platelet count. Up to 80% of infants born to mothers who had rubella during the first 12 weeks of pregnancy developed congenital rubella syndrome. This syndrome presents as congenital cataracts, congenital deafness, congenital heart defects, specifically patent ductus arteriosus, and mental retardation. For the diagnosis of the disease, a rubella blood test is done. It detects antibodies that are made by the immune system to help kill the rubella virus. For the early diagnosis of infection, a rubella-specific IgM by ELISA is done, while after 14 days of an acute infection, IgG seroconversion is performed. The management of rubella is supportive. For the prevention, rubella vaccine is usually given as a combined measles, mumps, rubella (MMR) vaccine. Doctors recommend that children receive the MMR vaccine between 12 and 15 months of age. It's particularly important that girls receive the vaccine to prevent rubella during future pregnancies. Because MMR vaccine is an attenuated live virus vaccine, pregnant women who are not vaccinated should wait to get MMR vaccine until after they have given birth. Adult women of childbearing age should avoid getting pregnant for at least 4 weeks after receiving MMR vaccine. That's all for today. We hope to see you soon. Bye doc.